Welcome to seminar number 7. So I would like to introduce Jennifer Johnson. Jennifer is the founder of the Atlantic School of Reflexology in 1999. Jennifer's passionate, award-winning instructor who has developed and taught reflexology and holistic therapy courses across Canada and internationally over 2 decades. Having earned multiple diplomas and dozens of certifications in massage therapy, lymphatic drainage, reflexology, and complementary medicine, Jennifer's mission is to apply her expertise in augmenting the reflexology profession by inspiring other therapists to achieve excellence in their own clinical offerings. In her own private practice as a holistic therapist with energy sight, Jennifer complements her knowledge of anatomy with an understanding of the intricate energy processes of the body, backed by 25 years of working with clients. She loves to draw from actual experiences to answer questions from students. In 2019, Jennifer won the Excellence in Teaching Award from Reflexology Association of Canada. So welcome, Jennifer. Thank you so much for joining us. I'll hand it over to you.
Okay, thanks so much. Hi, everybody. I've already seen a couple familiar names pop up on the screen, so I'm really happy to see everybody here. Hi to Canada and whoever might be joining us from somewhere else in the world. I'm thrilled to be here and with you guys this morning. So I'm used to a format where I usually have people talking and kind of an open class format, even though a lot of stuff's been done online lately. So I am actually open to questions as they come in, and Haley is able to read those. So as long as we can kind of keep a rhythm happening and there's the odd question that pops up that seems, on topic to what we're talking about, I'm happy to answer it. And if not, then we'll wait for a few at the end as well. Anyway, so there seems to be a lot of interest in lymphatic reflexology as of late, which I'm thrilled about. As well as just lymphatic drainage, which is done on the body as a therapy, a modality that's done on the macrocosm body versus at the reflex body. Okay, and so in terms of reflexology and lymphatic drainage, we actually have some advantages over full body lymphatic drainage in that there are some contraindications or sometimes that you would not do body lymphatic drainage, but you can do lymphatic drainage from the reflex perspective from the mini body because actually you're not touching the areas or actually stimulating the reflexes or the lymph drainage at the site itself. So just like all reflexology, anytime for any system, anytime you're ever pressing any of the reflex buttons on the feet or those energy reflex points, all you're ever doing, I think of it as a way of communicating to the body. So whatever the mechanism of action, I know there's a lot of different theories and some really interesting studies that are happening, but whatever that mechanism of action is that allows the body to actually understand that we're asking it to focus on a part of itself, and where it's got the resources to self-correct, we're encouraging it in that direction. The same exact thing is happening with lymph reflexology. So just like every other part of the body, just like every other system of the body, and just like the entire holistic view of the body, you would do lymphatic reflexology as part of the whole and as part of the holistic approach. And it does have the exact same limitations or contraindications as your regular reflexology would have. Okay, so conditions of the feet locally, or maybe partial contraindications, or thrombosis, blood clots, that kind of thing. So whatever your original training is with foundation reflexology, those same things apply. If you do decide to go into more advanced lymphatic work, then it is possible there's more things that you would be aware of if you're working with very challenging cases, and in some cases maybe someone would have advanced cancer or something that you're wondering if you should approach and get a doctor's permission. If you're ever wondering and you're unsure, then I would always say go with your gut. And if you're curious, if you think there might be a risk, then certainly you can ask. But the bottom line for lymphatic drainage, as incorporated with whole reflexology treatment, where you're working all the organs, all the systems every single time, it's exactly the same as a regular session, which means that as a foundation reflexologist, I'll teach you some extra techniques that you can work on today, but there's nothing specific you have to do that's different, and you can incorporate these right away into your practice, and they're very effective. So I thought we would start with just talking about like what is lymph, and what's the lymphatic system, and you probably learned it in partnership with the immune system. because they work very closely together. And sometimes they're considered like a subset of each other. Sometimes they're considered separate from one another. But I'll talk about lymph first of all, in terms of what lymph is, and then how it relates to inflammation. And then obviously we'll get to what we can do to help people overcome inflammation or feel more comfort if there's pain that's involved with inflammation. So if you think about the circulatory systems of the body, we think most often about circulation and blood. And interestingly, lymph actually comes from blood. So what happens is with our circulatory system, which is a closed system, we actually have blood that's coming back from the body after it's gone on its journey. It's deoxygenated. It's probably picked up some waste. And then that actually goes into the right side of the heart, gets pumped to the lungs for reoxygenation and to get rid of the carbon dioxide. And then we breathe in new oxygen, and it goes from the lungs into the left side of the heart, where it then gets pumped out into the entire system, right, for systemic circulation. So you have pulmonary circulation, which is blood going to the lungs for the gas exchange. And then we've got systemic circulation, which is the blood going to every other part of the body. Now we know that blood is, one of its uses is transportation. So it transports things. And it does that through a medium. And the medium for blood would be like the watery part of blood. So blood contains water. The watery part of blood is actually called plasma. And it carries things that are dissolved in it, like hormones. And it also carries things, the plasma helps kind of float along the red blood cells and white blood cells. So these are all parts or components of blood. Now, what happens is when blood goes into systemic circulation via this closed system of going through the arteries first and coming back through the veins, let's say it's going out to the tissues and it has to drop some stuff off. So it's going to drop off oxygen. Those oxygen molecules can slip right through little tiny microscopic capillaries, the tiniest little blood vessels, and it can slip right into the tissues, right? So that it can supply the cells with some oxygen. So there's lots of little tiny things that can just kind of get dropped off, and they can fit through the little tiny holes that are called fenestrations or fenestrated capillaries, little tiny holes in those microscopic blood vessels that can slip things out into the tissues, right? Which is all like the tissues made up of cells. And it can slip those little things so that the cells have access to them, to nutrients, to oxygen, to what they need to survive and do their job. But there are some things, every time the blood drops off those little things, it also drops off a little bit of water. And that little bit of water also goes into the tissue all between the cells. So I'm going to show you a picture here for a second, just so you have an idea of what we are looking at when I'm talking about a closed system for the circulatory system. So if you hold on just 1 second, I'm just going to pull this up. Okay, and so here's our closed system of circulatory system. And we can see that as the oxygenated blood is leaving the heart, and in this case, this is the left ventricle. Okay, so imagine you're facing this person. And so here's the left ventricle, and the blood leaves the heart, which is now oxygenated. It's going through the arteries. The arteries actually have a very high pressure because it has to be pushed to the far regions of the body to supply all the tissues with what it needs to drop off and transport. And now as this blood going through the main artery, the larger to smaller arteries, which become arterioles, which eventually become this capillary network, this little capillary right here, I want you to imagine it like it's completely connected. So if you look at my fingers, what it means by closed system is that one side is the artery side, the other side is the vein side, but they're really completely attached as if these are just tubes and not fingers that can come apart. So at some point, once that oxygen slips out of the arterial side of the capillary, then it just carries on. The rest of the blood carries on through the venous portion of the capillary without oxygen. And then as that's happening, because there's also a high pressure in there for the artery side of things, a little bit of the plasma leaks out into the tissues as well. So at the point that the watery part is in the blood, it's called plasma. Once it leaks into the tissues, now it's called something else. And ultimately, that's what's going to be what we call lymph. So just to get yourself thinking about what that actually means, what lymph is, if you can imagine at some point that you might have scraped yourself, and it was enough that you felt a little bit raw, so you put a Band-Aid on it, but it wasn't bleeding. And then later you take your Band-Aid off and you notice that there's like this little kind of almost yellowish clear smudge on the Band-Aid. So that actually is lymph. That's what it is. It's the watery part minus the red blood cells and the other things that would make it blood. They're the other components that make it blood. So that's what lymph is. When it's actually in the tissues, it's called interstitial fluid. You don't really need to know that, but just a little extra. And then after, what it does when it's in the tissues is it gives the cells a bath, essentially. So let me just flip to a different chart, but just from this one, what I want you to see is that it's actually a closed system, that the capillaries are actually connected, and at some point the oxygen slips out at the capillary microscopic capillary area, and then it just turns into a vein. And as it's returning back to the heart, veins are structured differently than the arteries. The arteries have more muscles in their wall, and they're kind of squeezing by the pulsing of the heart, but they also have some muscle in their own walls, whereas the veins have much less muscle in the walls of these tubes, and they actually have valves to prevent backflow. That's kind of an interesting little thing to remember, and I'll tell you why later when we compare the lymph vessels. But this is a closed system. Okay, so that's what I want you to see there. Okay, so now if we talk about the lymphatic system separate from the blood system, the lymphatic system, one of its really important jobs is to collect that bit of fluid that was dropped off into the tissues. Okay, so its job is to take water from the tissues, and eventually, way down the line, after it's done filtering it all out, it wants to dump it back into the bloodstream, and it does that up here underneath your two clavicles. Okay, so under the collarbones are two little veins. And so that's where the little valves are, where lymph will rejoin the blood and what will become plasma again. So it's just this fluid in the body, the watery part of the body, that just constantly cycles and recycles and recycles and recycles. Okay, and then different things happen to it along the way, depending on different immune functions, or if you actually do have an infection and the body has to start cleaning that up, if you actually did have a fall and a cut, and the body has to start sending some healing agents to where that cut is so that the scar tissue can start to form and seal it off and stop the bleeding. So, lymph at different times will carry different things in it at different states of its travels, and we'll talk about that a little bit more as well. So let me flip on to one more share so that you can see what lymph is as it's going through the body. Okay, so now here we have the lymphatic system, and it actually is the lymphatic system. In this case, I'm just going to call it the lipidemia system, and we'll talk about which parts are immune, which parts are lymph, because really there's a lot of crossover in there. But what we have as part of the system, you can see that all of these vessels, right, they look like blood vessels, but the lymph system has its own complete network of vessels. It has its own vascular system that are separate from blood. So as that closed system of circulatory system of blood is going around the body, it's leaking out a little bit of it, the plasma, into the tissues. It doesn't leak all the plasma out, obviously. Blood has to keep carrying on, but it leaks some of it out. It leaks out about 2 to 10% of the plasma into the tissue area. Okay, and so that means that about 2 to 10% of the tissue that ends up in the fluid has to then be drawn back up, not back into the blood like the rest of it did, but drawn back up into its own set of vessels, which are the lymphatic vessels. And this is where the interesting thing happens. When it's in the tissue, we can kind of broadly call it all lymph, really, but when it's in the tissue, technically that's interstitial fluid. It's only once it actually ends up inside the lymph vessels that it's now called lymph. Okay, so it gets its name lymph from the vessel that it's inside. And that makes it a little bit different. And then the components will be a little bit different as it goes along this route. So here's an interesting thing about lymph, where the circulatory system for blood is a closed system that goes all over the whole body. The lymphatic vessels are an open system, and they actually only have one direction flow. They only can go in one direction. They cannot go in another direction. They can slow, they can stop if there's a blockage or an obstruction. Gravity can kind of pull it down, but it cannot reverse and go backwards. It only can go in one direction. And so lymph, if you imagine, if we know that the lymph drainage points are up here under the clavicles, this is where it wants to rejoin the blood and become plasma again. If this is where the end point is, and if anyone anyone is watching that is actually a massage therapist and you are familiar with lymphatic drainage on body, or you do lymphatic drainage massage or techniques, then you know that this is the area that when we work it and we slightly stretch the skin right here, that's actually opening the little valve, the little flap that helps lymph pour into the vein a little more efficiently. And this is actually called clearing terminus. So think of the word terminus, like the end point or the end of the line, right? Terminal, bus terminal. So end of the line for the lymph, where it now rejoins the blood. So if this is the end of the line, where does lymph have to go to get there at whatever body area it happens to be in? So let's imagine that I have lymph that's been dropped off in the tissues of my hand and the muscles, like all around. And then so now that fluid, if it kept getting dropped off, and never getting picked up, then I would just like blow up like a great big giant water balloon. So the vessels, the lymphatic vessels that are down here, they kind of weave into the capillaries. So let's imagine this is the little tiny microscopic capillary. I'm just going to show you like half of it, but pretend it's totally connected. And then here are the little lymph fingerlings. Okay, so they actually do look like little tiny fingers that are just woven in amongst the capillaries within tissue that would be made up of cells, all kind of little cells everywhere. So it's those little tiny fingerlings that actually kind of suck up the excess fluid. And I just think of it like a water vac, right? Just like it's in there and it's in the tissues and it's woven in amongst the capillaries, and it's just like, just sucks up the extra water from the tissue. And now it has to go somewhere. So how is lymph from here going to get all the way up here? It has to go up. Okay. How is lymph from the lower body going to get all the way up here? It has to go up. So whether it's the legs going up, whether it's the trunk of the body, it has to go up, right? From the breast, it has to go up. And it has these different routes. So lymph vessels actually do have the same kind of order as blood vessels do. Let's think of them as very similar to veins. They have valves that prevent backflow. Okay. And they start with capillaries. Okay, so they also start with little tiny microscopic capillaries, but in this case, they're not connected. It's not closed. They're just open. They're just little tiny fingers, little tiny little extensions that are like little tiny water vacs. The capillaries lead to vessels, and then they eventually lead to larger trunks, and then they eventually lead to the ducts where they empty back into the body. So for the lymphatic ducts, you have two of them, one on the right, one on the left, always here, always this is where lymph joins blood. And so the only place where lymph actually gets drained down, logically, has to be from the head and the neck. Okay, so everywhere else it has to go up to get here. All those valves helping it prevent backflow. And the lymph is climbing up. And only here does it come down. So I'm going to show you another diagram here. And I'll come back to this one. But the next diagram is, thanks, Daisy. There we go. Here are the lymph capillaries and the tissue spaces. And so we can see that this is an arteriole. It's leading into this little tiny microscopic capillary where half of it is still oxygenated blood. And then once it gives up its oxygen, then it becomes the venous side of the capillary, which leads to a venule. And then it ultimately becomes to a larger vein and the larger vena cava. And here's what I mean by these little tiny fingerlings. This is a lymphatic vessel, and as it's all woven in between the little spaces within the capillary, you can see that all these little tiny circles, all these little tiny smudges all around all these little dots, those are all cells, okay? So essentially what happens is once that little bit of plasma leaks out of the arterial capillary, it gives the cells a bath. Think of it now like bath water, okay? And so it's giving all of these cells a nice little bath. It's cleaning stuff that could be in there. So what could be all in between the cells in a tissue? You could have foreign matter if somebody cut the skin and something got inside, like maybe I got a wood splinter and it's got to kind of break that down and get rid of it. We could have cellular debris. We could have little tiny cancerous cells. We could have, a virus or bacteria or even a bit of a fungus. So there's all kinds of stuff that could actually be contaminating cells, including just regular metabolic waste that happens after the cells do their job and spit it back out again. So imagine that all this fluid around the tissues surrounding all the cells, it's dirty bathwater. We want to collect it into these closed system lymph capillaries, little tiny fingerlings. And do you see these arrows? They're just going in one direction. So once that little wet vac sucks up the liquid, now it has to find its way to a vessel, then a larger vessel, a trunk, and then eventually back up to the drainage area. Okay, so now the question becomes, how does lymph become clean before you dump it back into the blood? Because nobody wants to have dirty lymph dumped back in to become dirty plasma within the blood, especially if it's carrying a bunch of germs and stuff that we don't want in there. So what happens, rather than it just dumping dirty blood back in, is the blood has lymph back into the blood. The lymph that's getting collected passes through a whole series of lymph nodes. And if you guys have ever felt for whether you're sick or your kid's sick, you know that there are certain areas where you've got these little clusters or groupings of lymph nodes. And frequently it's where a doctor would check, say you had mono or you're going to see the doctor because of a throat infection, and they'll start feeling around. There are lymph nodes actually everywhere in your whole body. So you've got 400 to 600 lymph nodes. So good average number is 500. And then as we're working along with the lymph nodes in these groupings, they could be absolutely anywhere, but they tend to cluster in groups at certain areas. Those would be called lymph chains. So here are the ones that we would have learned probably in our foundation course for foundation anatomy physiology. We have lymph chains in the neck. Those are called cervical lymph nodes. We have them in the armpit. Those are called axillary lymph nodes. We've got them in the elbows. Those are called cubital lymph nodes. And then we also have them in the groin area, in the crease of the leg to the trunk of the body. So those are your groin lymph nodes, or inguinal is the other word for them. And then we also have them behind the knees. We've got some in the abdomen. We've got some in the center chest area, but those ones are deeper. And we do have some that are kind of surrounding the small intestines as well, especially on the right-hand side, from where the small intestines meet the large colon. Okay, so those are kind of your major groupings of where lymph nodes are. And if you look at this lymph node right here in the picture, the lymph node is going to be bringing lymph into it that is essentially dirty lymph. And then it has to go through the center of the lymph node, which is a filter. And if the lymph node is acting as a filter, there has to be something inside of it that's actually filtering lymph. So what is it that makes the lymph node a filter? So that as the lymph leaves the lymph node on the other side, it's cleaner. And what is inside the lymph nodes are white blood cells, part of the immune system. So when you guys have a swollen lymph node, what do you think that means? Let's assume that it's not cancer. It's not that the lymph node itself is affected or has a pathology or something wrong with it. But let's say just like a regular, generally healthy body has a swollen lymph node. Why and what does it mean? It generally means you've got some kind of infection or a virus or bacteria. It's usually at the site where there's something happening, right? So if I do have strep throat, then these ones are going to be swollen, possibly the ones in behind my head or ahead of my ears, right? So if I have something happening with my ears or throat, those are the ones that are going to be swollen, probably on the same side actually as the one that's infected, if I have an ear infection. And what happens here is the immune system got triggered that yes, there's something we found in the tissues. We need more help here at the lymph node because it has to be a bigger, badder filter. It's got to be a really big, powerful filter. So it sends off a signal. White blood cells rush to that lymph node and make it larger so that it's a more powerful filter. That's actually good news. The bad news when you have a swollen lymph node is that you've got something the body's trying to fight. But the good news is a swollen lymph node actually means your immune system is working and it is fighting whatever got into your system. Not only does it come out of one lymph node and then go into the other one cleaner, but it goes into the next one and the next one and the next one. So it goes through a whole chain or a whole cluster of lymph nodes in any given body area. So that by the time it does come back to the end of the line where it's got to be drained into the ducts, now it's very clean and it becomes plasma again, ready to go through that whole cycle all over again. Okay. For lymph nodes, if they're in an area like just swollen in the neck or throat area, that probably means you've got something happening in this area. If they're full body, if everywhere you touch there's swollen lymph nodes, like when they check for mono, it means you have something systemic going on, right? That's affecting the whole body and the whole body's trying to fight something off. Like anything, lymph nodes themselves can become sick, but that's something a little bit different. Okay, and I think what we would probably relate to the most with that one would be our knowledge of, we would generally hear about people having cancer within the lymph nodes, okay, if they become infected. Okay, so let me go back out of this for a minute. Let's see if we have any questions at the moment. Does anybody?
Jennifer, yes, there is a question.
Yeah.
It says, is this still beneficial for lipidemia? What's the difference to lymphedemia? Sorry if I've mispronounced.
Okay, I didn't hear the first one. Lipodemia, or are we just talking about lymphedemia in general?
the question says lipidemia.
I'm actually not familiar with that. So we'll talk about lymphedema, or a collection of lymph, particularly at the ankles. And there are multiple conditions that can happen with lymph. So it is just a matter of, just looking up like you look up any other condition. So I'm sure there's some that I'm not familiar with. Okay. Sorry, I just tried to read a question, but I'm not good at two things at once. So I'll let Haley handle that. Anyway, we are going to talk about lymphedema in a little bit. So once we're talking about specifically, I'm going to show you guys how to measure a foot, how to measure the girth of a foot when you're working with someone who has a swollen area, particularly at the ankles is where lymphedema happens generally. And so once we're working with edema and measuring, I'll talk about that a little bit more. That'll be something that we'll finish up with shortly. Okay, so let me just jump back into anatomy and physiology here for a second, because we do want to know what lymph does and what the purpose of lymph is. We are already trained in reflexology. We're already trained that reflexology is holistic. We already do have a set of things that we'll use when people have inflammation. An example is we would work on the adrenal gland for inflammation because the adrenal helps release anti-inflammatory factors via cortisol. So in any case, we already have kind of our protocol that we do. And we could also work the other end of this, which is very important, is that once the liquid is collected, the excess fluid from the tissue is collected and gets dumped back into the blood. Let's say you actually did have something that was swollen. Let's just say you fell off a ladder and you hurt your hip and your hip was all swollen. There's like a bunch of extra tissue fluid in there and it's red and hot and swollen and has pain. That's generally what inflammation is, okay? Red, hot, swollen and painful. So if you've got something that's actually swollen, there's probably a little bit more than we need to know, but it's so fascinating to me, so I'll share it anyways. The white blood cells of the immune system actually start to release chemicals when you injure yourself, when you have a tissue injury, like muscle injury or a cut or a wound. So it will actually start to release these little chemicals that make the capillaries a little bit more open. Okay, so I said they were fenestrated earlier. They've got little holes that will leak out this fluid. Well, if there's an injury, they get triggered to make their holes a little bigger, to leak out a little more fluid into an area of injury. And the reason for that is because it's trying to drop off healing agents and healing chemicals, right? It wants to stop the bleeding and it wants to actually start releasing factors that will start sticking the tissue together so it can start healing and form a scar. So it's delivering that. When you have an injury, you've fallen and it swells all up, it's actually, again, a function of a working immune system because your immune system's trying to send extra help to that area in the body, okay? So that's kind of the really cool thing about that. So we do have, in terms of reflexology and what we work, we've got body areas that you would work. If I injured my hip, you'd work the hip area. You'd probably also work a referral like the shoulder. It would be painful. You'd work your pain reflexes like pituitary or maybe some of the chronic pain reflexes. So you'd work kind of your regular protocol that you normally would, and you would work lymph, right? You work all your lymph reflexes. But then the question is, if you are actually reducing the swelling from a body area, where does it go? Right. So if you actually take the swelling and the big kind of tissue expansion and the heat and the redness and the soreness, and that tissue fluid gets drawn away from there via the lymph vessels and the hip swelling goes down, where does that extra water go? Because if it just goes back in the blood, wouldn't there just be too much water in the blood again? And the answer to that one is, once the blood actually carries on its own circulatory function, like it always does, at some point it runs into the kidney. And the kidneys filter the blood, right? And the kidneys balance fluid levels by removing the excess, what would now be plasma from the blood, which was originally the swelling at the hip. It's got taken back into the blood, got dumped in as plasma. The kidneys now filter it and you pee it out. So anytime there's inflammation and you get reflexology and then people pee more, yeah, that potentially is a symptom of toxin release, but it's also potentially balancing fluid levels because the swelling has gone down and the person's actually peeing out what used to be a swollen ankle, a swollen hip, a swollen knee, or whatever it might be, right? Post-surgery or whatever. And then we have things like chronic inflammation, chronic inflammatory conditions. And this is where we move into, like so many people currently have autoimmune dysfunction. So autoimmune diseases, autoimmune conditions. And I'm absolutely betting that as therapists, you guys have a high degree of your clients that have something happening with inflammatory conditions. There's a huge stress relationship to inflammation. When stress goes up, so does inflammation. Anything itis, anything that ends in itis, you know that's inflammation. And so we can have internal inflammation that we can't see the redness, we can't see that it's swollen, we can't feel that it's hot or have heat, but organs themselves can become inflamed and tissues internally can become inflamed. So in that case, we do still honor working the whole body, we're working the whole immune system as we normally would, but I'll give you some extra things that you can also do. And whenever there's inflammation, there is pain associated with that, okay? Because the body's not meant to have this excess fluid in a tissue, and it does cause a pressure and a tightness. And because of all the agents getting sent to an area to try and heal it, it does get hot and warm. So there's a degree of heat there. Anything autoimmune actually means that your immune system, your client's immune system, whoever it's happening to, that has actually started overworking, but by accident, it's turned against itself. It's misidentified something within the body as being something it has to destroy and overcome and clear away. And so it starts attacking the body itself, itself. And that means autoimmune signals are the immune system getting mixed up. Okay, so we're still going to work, we'll work brain, we'll work nervous system, etc. So we really do need the whole body. We really need to work the whole body when we're doing this lymph work, but we're going to do a few extra things as well. So autoimmune just means the body got mixed up. There is inflammation internally, either on an organ, like say for Crohn's disease, for the bowels, large intestine or lesions, but there could also be just systemic stuff happening, okay, with inflammation. So we'll keep that in mind. Inflammation could be from an injury, from a wound. It could be short-lived. That's called acute. It's doing a job. It's positive. It's delivering stuff that needs to. It'll get cleared away when it's done, and we'll pee it out. Great, healed. But if it's chronic, and if it's related to autoimmune dysfunction, which is what a lot more people currently are experiencing, a lot more environmental allergies and sensitivities, a lot more just chronic pain and autoimmune diseases and conditions, that means we probably need to have a longer kind of treatment plan and strategy that addresses the whole system, but also specifically does help to balance those fluid levels via removing lymph from the tissues and letting it rejoin the blood as it should be. Okay, so that was actually focusing on the fluid part, the returning the excess fluid to the blood part. But there are a couple of other jobs that lymph also does. And lymph, one of its other jobs is it actually helps to digest fat. So when you eat something that's greasy, or even if it's like, a nice, beautiful avocado, then there's some fat in there. We'll call that lipids. The small intestines that actually do the chemical breakdown and digestion, where all your food's broken down into the tiniest little tiny bits. And then the small intestines are also covered with these networks of capillaries, right? So they're completely surrounded by these networks of capillaries. And the tiny little nutrient molecules will slip right out of the intestine, right into the capillary that's surrounding it, thus putting nutrients directly into the blood. But some molecules are too large. Fat molecules or lipids are too large. They can't pass directly into the capillaries. So instead, what happens is they get sucked up into a lymphatic finger, a lymphatic capillary, because they have a little bit bigger openings that will allow that size molecule to come through. So one of the jobs of the lymphatic system is to actually deal with digesting or breaking down fat further so that it can then get delivered back to the blood and to the cells so they can use it. And another part of that would be the fat-soluble vitamins, right? So vitamin K, A, D, and E. We need to process those via fat. So that's why some people tell you like take a vitamin with like a little bit of oil or in some yogurt that's got some fat in it, right? Because that'll deliver a little bit better. Anyway, so it's the lymph at the intestines that will actually help you take fat into the system so that it becomes usable, right? And it would be called fatty acids, or it would be called lipids, lipid production. Okay, so balancing fluid levels, lipid production. And that means that if anyone is kind of deficient in vitamin D and you're working with that, then it would be helpful to do lymph work to make sure that that's actually working properly as it should, working extra in the digestive or small intestines specifically. So let's talk about the, and the third function was immune function, which we talked about, helping deliver parts of the immune system that need to get where they need to go, to tissues that need healing. Okay, so let's talk about the components of the lymphatic system. If you guys do have your handout, then I kind of did this like I normally teach classes online, and I printed a handout that I was assuming or just wasn't thinking that you'd have a chance to print it off, but probably you didn't. So anyways, I'll just like tell you and you've got it for after. So now we're on to components of the lymphatic system. Obviously, the lymph system contains lymph, which is the watery part, and it contains the vessels, which have to actually contain the watery part for it to be called lymph technically. Those lymph vessels are similar to veins. They've got valves to prevent backflow. Then we have lymph nodes, which we talked about are filters. We also have a specialized type of lymph node that is also in the small intestines near the right quadrant. And yay, somebody printed it. That's awesome. Anyways, and so we've got another type of lymph node embedded within the small intestine on the right side, and those are called Peyer's patches. So they're a little bit specialized, but they're protecting the intestinal area. Also, we have lymphatic tissue, and lymphatic tissue is dispersed at numerous sites throughout the body. So it's really just like little bits of tissue, not fully an organ. But what's special about it is it has a high number of lymphocytes, which are white blood cells, specialized white blood cells with immune function. Some examples of lymphocytes would be like your B cells and your T cells. Okay. Now we also have a few other organs or glands. The tonsils and the adenoids, those are made of lymphoid tissue. They are specifically around the throat, and they provide this little ring around the throat. And they signal the immune system if something passes by them, and it triggers an immune response if it's something that shouldn't be in the body. But they're definitely made of lymphoid tissue. And we also have a spleen and then a thymus, okay? The spleen really can be thought of like an oversized lymph node. But instead of filtering lymph, it filters blood. And it's got a secondary function of also taking the lymphocytes and kind of storing them. So it stores lymphocytes and it also kind of synthesizes them or gives them a space to be before they're needed. And in the thymus and the bone marrow are the only two organs within the lymph system that are actually considered primary. You guys are awesome. You guys, like, totally, so many people are going, I printed it. Like, yay. Okay, so the thymus and bone marrow, those are the only two places that are considered primary lymphoid tissue or primary lymph organs, because they actually they take these immature cells and they actually make them into specialized immune cells. At the thymus, they're called T cells, and just think T for thymus. And in bone marrow, they're called B cells, so just think B for bone. Okay, so T cells and B cells, which have to do with specialized adaptive immunity, where like an actual identified invader came, the body figured out what it was and what the defense has to be, and so it specializes its defense against it using these T cells. And the B cells have to do with kind of long-term memory, like humoral immunity, and remembering that this attack happened and that there was an antidote, so that the next time it happens, it can just come really quick and kind of attack it again. So those are actually immune organs and lymph organs, because they're making lymphocytes, which are part of the immune system, which are the white blood cells. Okay, there's a whole bunch of different kinds of white blood cells, but those ones we'll just talk about the most. The other kind of white blood cell that is present within the lymph nodes is called a macrophage or macrophage. And those guys are actually, they're like little goblins. They will literally eat up bacteria. So they'll sense something comes in, it's something that shouldn't be there, it's inside the filter, and they'll just gobble it up. So they actually eat it, they poop out the waste into little teeny weeny bits that can then be dispersed and gotten rid of. But anything that's larger that needs to be eaten and neutralized, it's the macrophages that eat it. So just think of them like little Pac-Men that kind of live inside the lymph nodes. Okay, so those are kind of your big groups of white blood cells. Okay, anyways, moving on. Lymph contains 4 things. It has proteins. It's obviously made of water, so water is kind of what travels everything around. It has proteins in it. It has cellular content from the cellular metabolism, the jobs that the cells are doing, including lymphocytes, bacteria, viruses, cancer cells, cellular debris. And it also has fatty acids from when it's taking up some of the fat molecules to break it down further so that it can contribute to body function. Okay, our lymph vessels, I already did cover this, but I just want to review it. So the lymph vessels start with capillaries, just like blood vessels do, an open system, fingerlings. Then they move up to lymphatic vessels. There's other names for these too. If anybody actually is involved in lymph drainage and you've heard other names being used, they're not standardized. So there's a few other names for this kind of hierarchy of how the cells are. So the lymph capillaries, the tiniest little microscopic ones, they also could be called initial lymphatics. Okay, so you might see that in some literature. Lymphatic vessels could also be called collector vessels, or they could be called lymphatics in general, which basically means they're collecting from the initial lymphatics or from the capillaries. Then we have the lymphatic trunks. Okay, the trunks are actually super interesting because most of them are paired, as in we've got, I'll just say we've got the two lumbar trunks that kind of collect from the lower body, and they connect down low and then go up the main trunk. But there's only one intestinal trunk. So there's several different trunks that exist, mostly in pairs, but the intestinal trunk is only one. Then those move into the thoracic duct mostly, or to the right lymphatic duct, and then get drained into the drainage areas up here. Okay, so we can think of it like a tributary system or a watery system. Now, I'm going to come back to share screen. I want to show you something again.
We do have a few questions. Do you want to do them now, or would you like to wait until
Sure.
after?
Yeah, let's do some questions.
Okay. Linnell is asking, would you consider lymphedemia an infection? And I know you mentioned that anything that ends in itis is considered an infection, but maybe you want to just clarify.
Sure. Okay, so anything that ends with itis is inflammation. Itis literally means inflammation. Whatever that itis word is stuck onto, so hepa means liver, so hepatitis means inflammation of the liver. But if the question is edema or lymphedema related to infection, you can have lymphedema for a whole number of reasons. So lymphedema itself as a condition, it does not have one unified cause. It means that there's an area that has too much fluid in the tissue that's bogging it down, and that collecting that fluid up into the lymph vessels is difficult for some reason. But it doesn't actually mean anything more than that until it's investigated further. So you could actually have edema related to pregnancy, just different hormones and how blood's being collected. It could be, for like a long flight. It could be hereditary, that people tend to have maybe not super great valves for their lymph vessels. And so hereditary wise, people in the family tend to have like kind of wider ankles or lymph collecting around the ankles. But it could also be from heat. It could be from weight gain. These are relatively benign reasons. And usually lymph can then be moved along by either, actually, this is a really good one too for everybody, deep breathing. Diaphragmatic breathing actually contributes to a lymph pump. So if you have lymph collecting anywhere in the body, deliberate diaphragmatic slow breathing acts as a pump to help move it along. So does exercise. So does actual circulation. So the actual pulsing of the arteries that lie parallel to the lymph vessels kind of gives it a little bit of a vibration that also makes lymph move inside the lymph vessel. So even though it's not pumping itself, it does react to the arteries pumping with the pulse, which means get your circulation going, right? If you increase your circulation, which reflexology is amazing for, then you're automatically increasing the uptake of lymph as well. So these are reasons that are kind of relatively benign, but you could have an infection, definitely, that leads to swelling. And there could be also a blockage. There could be restricted flow for some reason. And there are more serious causes of edema, which could be potentially something like a blood clot could be related. If there's so many causes that blood clot related edema, basically if you're asking your question on your health form, that's as far as you need to go with that, unless there's the red flags that you learn in your training. But that's one reason. But also there could be like a literal blockage, or maybe there is cancer in some area or tumor somewhere that's preventing the collection of lymph. So there's other reasons why it might be there. And if a regular course of action, like regular lymph uptake, things that were meant to improve it, like lymphatic massage or lymphatic reflexology or exercise or deep breathing, if that doesn't tend to work and it's not clearing and it's been long-term, then we really do need to have a diagnosis there. Some more serious conditions that are involved with that would be like heart failure, congestive heart failure, kidney failure, right? It could lead to like a really serious edema that's not clearing. Okay, and so there'd be so many other symptoms involved in that. Someone's not going to show up feeling relatively healthy, but just have swollen ankles. If that's happening, it's going to be a lot more stuff. So just like everything, this is why it's so good to work lymphatic reflexology, because it follows all the same rules you already know. If there's something that's unidentified, an unidentified change in health, an unidentified cause of pain, an unidentified swelling that's ongoing and is not correcting, clearly they have to go to a doctor and have a diagnosis. Okay, so that was a good question.
Jennifer, sorry. The comment before was lipidemia, and then she says not lymphedemia. So lipidemia, is that when you have very swollen legs? Is that how I'm understanding?
Well, possibly you could give us a definition of lipidemia, but lipo means fat, right? Or it's something to do with the lipids. So possibly it's a collection of fat. I don't know. This is my guess. I would have to look that one up. I wouldn't just guess and go work on somebody. So if you have a little better definition of that, then you can certainly put it forward, but I don't honestly know. Yeah.
Okay, there's another question. Is this treatment okay to do on someone with breast cancer that it has gone into her lymph nodes?
Okay, so here, this is like super interesting question to me, because we also have like this, I just saw there was a reflexology and cancer table at the rack tables that you guys can go join. There is a reflexology protocol for working with people with cancer. For a long time, it was thought that you can't do reflexology with people who have cancer because what if you make the cancer spread? But the other side of that is if you're doing the whole system every single time, you're working on the brain and the nervous system, you're working on the immune system, then would you not also be helping the body to determine if it has the resources to self-correct? Are you not giving an opportunity to go, okay, what could I do inside myself that could help this heal? And I mean, not everything is going to be healed through. Sometimes we do work with people who have conditions that are terminal. And we have other things we can focus on there. But lymph reflexology doesn't actually have the same contraindications as lymphatic drainage on the body has. And that might depend on how you practice and where you kind of see yourself in this. And if you have any doubt, you could ask someone, just ask their oncologist if lymph drainage is reflexology would be appropriate. But every time I've ever asked, it's been given, people actually come because they've been referred to by their oncologist who want them to have reflexology done and lymph work through the reflexes, especially if I explain what it is that we're doing and that involves the whole body, including the immune system, including everything. Because you're right that there are some cases that massage therapists, for example, are told, don't do lymphatic massage if there are lymph nodes that have cancer, because you could encourage the cancer cells to leave a particular node and go somewhere else. When you're doing the entire foot, you're not actually stretching or moving the lymph vessels themselves on site on body. You're asking that little button, hey body up there, hey lymph node, is there anything you've got as a resource yourself that will help you heal through this, including the entire rest of the system, which you're working every single time anyway. So my answer to that would be that no, it is not contraindicated, and that yes, you can work with people who have cancer, including people who have cancer in the lymph nodes, but you would work it as an entire system like you would do all of your reflexology, or you wouldn't just isolate one particular little thing and work it all by itself. So you've got the whole body working with dealing with this illness and seeing if it's got resources, how far it can take that into healing or into a comfortable transition of some kind, or into ongoing just comfort care. Shall I go on?
Thanks, Jennifer. We do have some more questions, but you can go on. We can answer them later if you'd like.
Okay, sure. All right, so let's just see what it's taking us to here. Here we have actually, that was a great leading question, because these are actually swollen lymph nodes. So if you see, and it's an interesting thing to kind of look at how lymph moves through the breast area, because as a reflex, we just learned that the breast is like the top of the foot, right? The whole top instep and the dorsal aspect, and that lymph actually are all these channels down through here as lymph reflexes. But the lymph around the breast actually drains some of it to the medial aspect, into these deeper lymph nodes that are kind of the mediastinal, or the ones that are between the ribs in the middle of the chest bone. And then the rest of them kind of go over here and lead up to the axillary lymph nodes, which are underneath the armpit. And these ones show some swollen lymph nodes. So they could be swollen lymph nodes because they're dealing with infection, or they could be swollen lymph nodes because they're dealing with cancer, or maybe they themselves have been infected with cancerous cells. And so the cancer has moved into the lymph nodes, and the lymph node themselves could be removed. So, so this is just like a nice little view of the network, where we have groupings of these nodes, what they would look like in a healthy state, and what they would look like if they are inflamed. Okay, like large and swollen lymph nodes are affected themselves. Okay. I want to show you this. in particular. Because when it comes down to us working on reflexology, I know that you guys are aware of the lymphatic drainage points, which are pretty consistent in most reflexology textbooks. So most trainings will have you doing the reflexology lymph drainage right in here, okay, about an inch down from the webbing. And so if you imagine this to be a body, and this is head and this is neck, here's your shoulder area, right? So this would be the clavicle. And so if this is where lymph drainage is right here, relatively medial, just underneath the clavicles. And so here it is here, same spot, right? So that makes sense why that would be there. But there is actually a reason why you might work on one side more than you would work on the other side. There's a reason for that. And you can only know that reason if you know how lymph gets collected and where it gets collected from. So this is what this diagram is about. This is this person's right side over here. The yellow side is their left side, okay? The left side of the body is actually collected, all of the lymph from the lower body, the lymph from the left half of the trunk and the left arm and the left neck and the left half of the head. That lymph all gets drained into the thoracic duct, which gets drained underneath this subclavian, into the subclavian vein right here, under the clavicle. So most of the lymph returning from your body goes actually into the left side as drainage. And that's a large trunk. That thoracic duct, it actually does go all the way up the center of the body, ahead of the spine. If you just follow that little pointer there, and then poof, gets drained right in here. The only body parts that get drained to the right side, to the right drainage area, which is called the lymphatic duct, the right lymphatic duct versus the thoracic duct. The right duct only drains the right side of the head and the right neck, the right upper torso, and the right arm. That's it. So now that helps us understand that if we're doing reflexology and someone has broken their right arm, then we are working a whole lot more on their right foot for lymph drainage to open that up, so that when lymph does actually get collected and now it's going to dump back in the blood, that's nice and open, is going to let it in. And if it's lymph from anywhere else in the body that's injured, let's say I had my left knee operated on, or even my right knee operated on for that matter, then I'm going to go to the left foot. So in terms of lymph drainage, it's an interesting thing to consider that your drainage point does relate to where the lymph's getting collected from, in that most of the body goes to the left drainage point. Okay. And so try and remember that one. That can change how you treat something. That will change the amount of time, instead of doing both lymph drainage, which you will do because you're doing the whole holistic thing. But then when you go back to refocus, wouldn't it be better to focus more time on the actual duct that is going to be receiving more lymph coming from those body areas that are related to it? So that's an important point. And that's in your handout as well. So you can go back and look at that. And it's just such an easy thing to see. You can tell where somebody's injury is based on what they're reporting to you. I broke my right arm. I, sprained my left wrist, or my ankle in either foot. And now you know which lymph drainage point you're going to work more on. Okay, so it's not like you're doing anything different in reflexology, but your understanding of how you're applying it is going to be a little bit better, a little bit different. Lymph coming up. Do you remember I told you there's some trunks? Now in longer training, if you actually do like an actual lymph certification, then you'll learn about all the paired trunks and where all those trunks collect things from very, very specifically. And there are things called watersheds in the body where lymph lakes, it's almost like there's like mountains dividing where water can pour. So there's more to learn there. But here are two lumbar trunks that are coming up from the lower body. And here's what I want you to notice. We're in the lumbar spine area. This is the thoracic duct. So the tube that ends up coming up the body, thoracic duct, that's going to then go into the left side of the body, into the left drainage area. That thoracic trunk, the thoracic duct, leads up from the low back all the way up the center of the body, and then pours on the left side under the clavicle. Notice that we're at L2 here, and this little bulbous swelling exists here. That is a little tiny receptacle. It's kind of like in your urinary system, like your bladder is just an empty receptacle. And then as urine fills it up and fills it up and fills it up, it becomes bigger. Same thing for this, which is called the cisterna chyli. And the cisterna is just part of or a large bulb at the entrance of the thoracic duct where the lower body is draining up to from the two lumbar trunks and from the one intestinal trunk. So as it's draining up here, it's like a little holding tank. So that if it can't all get drained and move up all at the same time, because a lot of stuff coming in at the same time, it'll let it sit here like a little container until it can move it along. Okay, so that's kind of neat. And this is a reflex that is missing on most reflexology charts. And it's an important one because it's actually a holding tank for draining the whole lower body. So we do have a reflex for that. And I'm going to show you where that is. But I'm betting that logically, you probably already know it's got to be in the lumbar area along the lumbar spine. Okay, so if someone has lower body inflammation, swelling, post-surgery, edema, anything happening lower body, work more on the low back area because that's where the cisterna exists, where it's a little holding tank. And then when it's ready, it can move that along up the body. And this is just where it is kind of in relation to the rib cage, just so you see the whole thing. So that's cool, huh? Okay, and now we have a reflexology chart. So for our reflexes, for the reflexology chart, I'm betting that this is pretty consistent with most reflexology charts, and that we have a throat which would contain a whole lot of lymphoid tissue for the tonsils and adenoids and that whole ring that exists in there. We have tonsil and adenoid reflexes that are also the base of the big toe plantar aspect. We have a thymus reflex. I did not yet talk about the thymus very much, but the thymus we do know is critical in developing the T cells, right? That's going to be for your adaptive immune system, that's specific defense against a specific invader that got in. The other thing about the thymus, though, is it's much, much larger in kids, and at about age 13, so around adolescence, it actually starts to shrink. And in adulthood, and in particular in late adulthood, it's mostly adipose tissue or fatty tissue. So it does its job. And if you think about it's designing specific defenses for specific invaders, that means it's actually designing these things that can then be remembered later. It's part of your long-term immunity, and the best time to have that most active is in childhood, where you're first getting exposed to everything in the world. Once you've had your first exposure to all the stuff that you've designed a defense against, you don't need to keep redesigning that over and over again, and so it shrinks and it becomes mostly fatty tissue. Okay, so thymus in older adults and seniors, pretty much not doing a whole lot of stuff. That we still have energy thymus points for people who are doing like energy tapping or body kinesiology. So the energy thymus still exists and has effect, but the actual physical thymus itself doesn't have a lot of immune function later in life. In kids, it has huge immune function. In kids, this chart would be different. In kids, the thymus is actually, in infants, it's almost the same size as the heart. It's very large. So in infants, it would take up a lot more space. So when you're working on children, you'd pretty much work that whole zone 1 under the big toe for thymus, for anything immune happening with kids, or building the immune system, or helping augment the immune system. And now we all know these ones, which are between all the long bones in the feet for lymph channels, lymphatic reflexes. Here's lymph drainage. We know the groin lymph around here. And then here's the cisterna, right, overlying the lumbar spine. And there's the cisterna, which collects lymph from the lower body. For all of these channels, for people who may be asking, do they relate to particular parts of the body? They do. And even if you didn't know about lymph in general and how lymph worked, or if you didn't know, the axillary nodes, for instance, you still could figure this out via your zones, right? So if you think about which zone is closest to a particular area, if we're looking at our grouping of lymph nodes that exists in this area, okay? So let's say breasts and axillary nodes of the armpit, then you're probably going to be closer to certainly zone 5 of the trunk and zone 5 where the shoulder is, right? And so this is actually your axillary, those are your axillary lymph nodes. And if you're thinking about, remember, part of the breast drained into the deeper nodes between the ribs, more central, you've got a mediastinal chain of nodes, they're a little deeper, well, that would be closer to zone 1. And so this would be kind of your chest mediastinal ones. And they are scattered all throughout the breast. So this would be kind of like, loosely speaking, we would call this the upper body lymph. Lower body groin lymph would also be called your inguinal nodes for people who are interested in what they're called, but you don't need to know what it's called to work it, so don't worry about it. And then cisterna right here. So add this one in, add the cisterna in, add in your awareness that more medial is probably more of the chest and some of the deeper ones, and possibly, and up along the spine would actually be the whole trunk. Okay, or the thoracic duct runs up along the head of the spine, ahead of the vertebral bodies, and then inguinals all in here, which is collecting everything from the lower body. So if someone has had knee surgery, work a lot more in the inguinal nodes. If they've had something happening upper body, it doesn't really do a lot to work the inguinal nodes, right? So if something's happening in upper body, it's being collected from the upper body and it's going to the upper body. You don't really have to spend a whole lot of time in the lower body or at the sternochyli for something that happened in the axillary area. So knowing how lymph travels helps you really hone in your sessions for reflexology. Okay, so let's take, I'll go back off of this. I'll leave that up because we're going to do some stuff on the feet, but what I want to do is answer a few more questions now. So if there's anything before we jump into actually doing some treatment possibilities, doing some techniques. I have feet here. I hope you guys have some feet too. And I asked you to have a marker handy just in case you have a foot handy or someone you can work on, because I'm going to show you that measurement technique, and it's helpful if you can mark where we're going to start on that. Anyway, okay, I will come back to this share, but let's just take a moment and see if anyone has any questions before we move on to techniques. Anything going on there, Haley?
Yes, sorry. Let's see here. Dawn is asking, would you do lymphatic drainage on someone who has multiple myeloma? And then in brackets, it says cancer of plasma cells. The person is receiving chemo, or would this be a contradiction?
So I think it's probably based on people's knowledge of cancer and reflexology, that it is something that in the past has been kind of a warning. And if they're doing chemo, maybe don't do reflexology at that time. But there's also some great workout with reflexology and cancer that supports that, yes, you should do reflexology with cancer. And that would include cancer in lymph. So I would, but if it's a question and you're concerned about it, then have the person ask their oncologist, right? Like, would that be okay? And to me, it's because we are asking the body, hi body, is there anything you can do within yourself? Do you have the resources? When I'm pushing this little button and you check into your own lymph system, is there something you can do with your own resources that would help you? I'm not actually pushing lymph along, right? You guys aren't pushing lymph. It's not like you're actually on the skin and doing like a real actual lymph massage where you are physically opening up all little tiny valves in the lymph and moving it along. That is an actual tactile pressure technique that literally moves lymph in certain areas. We're always making contact with the reflex. Making contact with the reflex is asking the body a question. And the question is, body, is this going to be helpful to you? And the body does what it can to fix itself. So from that perspective, if you go back to just straight up simple reflex theory, and our real genuine body contraindication is blood clots, and even that's argued at different points in the world, but certainly in North America, that's considered a contraindication. Then it's going to have the same contraindications as all reflexology. So that would be my answer. But I also, what would supersede that, what would come on top of my answer is your comfort level with your practice. And if you feel better, your client asking an oncologist, then certainly have that and then mark it in your health notes, in your records.
Thank you, Jennifer. So Wendy is asking, if you move too much lymph from the extremities, can it collect around the heart?
Yes. And that is if you are moving lymph physically, doing lymphatic drainage on body, on the macrocosm, on the real body, because you really are stretching and opening the vessels and pushing that along, even though it's very, very gentle. And yes, that could happen. When you're working through the reflexes, you're saying, hi body, is there anything going on here that you have the resources that would help you? Back to basic reflexology, the body knows best. You are a support person. I'm not pushing lymph. I'm not deciding. I'm not moving it. So is the body, when it listens to that energy cue that makes it focus on itself, is that body thinking that's a good thing to do? And while you're supporting the entire body holistically, including the brain, the nervous system, circulatory reflexes, pain reflexes, augmenting immune system. So it's that holistic question about reflexology again. Is cancer contraindicated in reflexology? It is not. Is heart condition or heart conditions contraindicated in reflexology? No, unless it's potentially blood clot related. So these are the guidelines, the same guidelines you follow in your regular reflexology are the guidelines you follow with lymphatic reflexology, because we're doing it via the reflexes, which is the body's making a decision. I'm not physically actually pushing lymph like I would be if I was working on the actual body, which would have different contraindications.
Thank you, Jennifer. So back to what we were discussing earlier about the lymphedemia. So we have another answer. She said, friend has massive fluid in legs, tried vibration plates, but has AFIB. I don't know what that is, so can't use it. She has lymphatic drainage, but it never seems to get rid of much.
Okay, well, sorry, I just thought of something, but can you read that last part again? The last sentence?
She has lymphatic drainage, but it seems to never get rid of much fluid.
Okay, so AFib was what she's describing, which is a heart condition, and people who have ongoing heart conditions potentially could have disruption in lymph flow, which is something, if it's ongoing, is not affected or helped by reflexology, then yes, they have to go see a specialist, a doctor and a specialist, and see if there's some other reason that this is not being collected, which could be an obstruction or just the heart can't keep up with it, the kidneys can't. So just like every client you have ever seen ever, this is to everybody, for any condition ever. If a client has a condition that is not improving, if it seems more complicated, or it's getting more complicated, or symptoms are accumulating and they seem to be getting worse, there is no other option but to have them go see their doctor and get an actual diagnosis for actual medical care, right? Because there's some stuff that's urgent care or that needs something that we are not going to provide by asking the feet, do you have any resources up there to correct yourself? I would think in those cases, the body's saying, no, I don't. I need more help. I need other kind of help. So things that are not clearing, doctor, and it's in that realm. Now, if you're doing something in support, right? But I wouldn't do anything instead of. So that has to be definitely something that's diagnosed and work with that way. So heart conditions could lead to that, kidney conditions could lead to that. Those are like the really big ones, but also an actual blockage somewhere along the vessels, which would be like a tumor, right? So that the actual vessels themselves cannot collect the fluid because there's a blockage there that's not letting it go by. This makes me think of something which is interesting. When people have their lymph nodes removed, and some people have had like cancerous nodes removed or like breast tumor and some lymph nodes along with it, right? When those lymph nodes are removed, they actually are removed from vessels that then just kind of like dangle in the tissue and they're not connected to anything anymore. And lymph can start to accumulate. It starts getting drawn up, but then it's got nowhere to go. It doesn't have a vessel to keep going through or node to go through. And so it just kind of collects in an area. What can happen with advanced lymphatic work on body in real life, not in real life, on an actual body, not via the reflexes, but the lymph vessels themselves can regrow and they can regrow different roots. So I like to leave room in reflexology. I leave room for miracles. I leave room for the body to figure stuff out that's like really beautiful that I'm not going to understand or know. So I think personally that there's always a good reason to do reflexology, so long as there's not one of our actual contraindications. Do no harm. But you're working holistically. The body knows things we don't know. It has resources to stuff we don't know if it does or not, right? And at the very least, you're at least helping with circulation and immune boost and helping it clear what it can and helping all the other systems work as well as they can, even while something else might not have the resources to be fixed internally. So I should move on to our techniques. And how much time do we actually have left, Haley?
So it looks like probably about 20 minutes. Yes.
Okay.
Because we're done at time zones 11:50 Central Time is when
cool.
this will be finished. So
so no, that's perfect. So we have 20 minutes. So if you guys, you can actually do this on your own feet. You don't have to have a plastic foot, but if you've got a BFF beside you, or your own feet, or if you have a model foot like I have, I'm going to show you some stuff so that you can actually make your lymph work a little bit more specific. And you have this in the handouts as well. So don't worry if you didn't print it, because you can print it after, and it's also in there. If you do have your handout, on the very last page is the measurement technique. It's measuring girth. It measures literally the amount of inflammation at the ankles, right? So that if you're trying to track over time the results of your treatments or what might be happening in change of symptoms, then girth measurement in something called a figure 8 is a really good one to keep track of, because it's actually standardized. And it's something that physios would know and nurses would know and doctors would know. And it's a consistent way that you measure the ankle or the foot so that you can know if it actually is improving and there is less inflammation, okay, less size, less fluid in the tissues. I'm going to do that one first so that you have an idea what we can do for measurement. So that's on the last page of your handout, and then we'll go back and do our actual techniques. So I got this plastic foot, a hard plastic foot, so that I can mark on it. And I'm going to say some terms here, but what really I want you to know is where I'm moving. So just watch where I'm actually going to do this. If you take your own foot, I'm going to actually get my own foot up. Take your own foot and bring it into dorsiflexion. So top of your foot is going towards your own head. And from the medial aspect, I want you to feel that tendon. That's the first one you come across just ahead of the ankle. And that tendon is the tendon from the tibialis anterior, the leg muscle. Okay, so the medial tendon, the one on the inside, when you bend your foot back towards your own head, that tendon is called the tendon for the tibia anterior. And so between that and the lateral malleolus, about halfway between that tendon and lateral malleolus, you've got to put a little mark on the foot, because that's where you're going to start. That's where you start your measurement. You start your measurement with a measurement tape. The only one I could find was in inches, but it doesn't matter as long as it's going to be consistent. So you take your measuring tape to that little mark, okay, halfway between tib anterior tendon and lateral malleolus, but then you draw the tape medially. So bring it medially and go around the foot back to where the tape is on the top. So you're going plantar underneath the foot and around to the top. Then you're crossing it and you're going to go around the back of the leg. But you are staying underneath both malleoli. Okay, so you can see that the medial malleoli is exposed here. I went under it, and the lateral malleolus, and the lateral malleolus also exposed. I went under it. And where I meet my original point of the tape, that's the measurement. So here I can say 18 3/4. Okay, if I'm doing it in inches, that's what I can write on my chart. If after my session, which frequently does happen with reflexology and lymph work, it is actually noticeable within a session. Part of it is probably the launch if their feet are raised a little bit, so that would be helpful all by itself. But also you might get like a 1/4 of an inch difference in measurement by the end of a session by doing your reflexes. So make sure you're measuring before, when they arrive, and after your session. And even if there is no difference, you can measure it again when they come back in next time, and again when they come back in next time. And we will have multiple sessions when you're dealing with something that's actively swollen. Okay, you'll have multiple sessions relatively close together. Okay, so our that's measuring girth. Now our techniques that we're going to do today, we have 5 techniques that we're going to add to what we do. They're not that different from what we already do. They're not hard to learn. So they're just like a different way of paying attention to it and something a little bit different that you can try. First of all, the lymphatic points that I talked to you about for lymphatic drainage. If you remember that the right side of the body, this upper quadrant, including the right side of the neck and the right side of the head, these guys drain down to here, these guys drain up to here, and the upper quarter, like of the torso, rib area and upper back area, shoulder, okay, that all drains into the right lymphatic duct. So if you remember that, then you can actually work on that one more for stuff that happens in this given area. And the entire rest of the body is the left side. You don't even have to remember what drains to the left side. Just remember what drains to the right side. And if it's not that, then it's going to be the left, okay, into the thoracic duct. So by using that, what I literally wrote into your text, just so you can know what I'm talking about when you go back to your handout, it says, in addition to what you already employ as lymphatic techniques, which would already include, working the adrenals or, pituitary if there's pain involved, and your regular lymph work. So do your regular lymph for the whole body like you normally would, all the support immune stuff, the spleen, etc. So your whole immune system, your whole lymph, and the support stuff, like always. Then lymphatic drainage points used specifically by drainage region, okay, right lymphatic duct or the thoracic duct. You can do a slow pulsing, or you can do a sustained hold, like 20 seconds. The more swelling in an area, the slower your pulse should be. So you could do a pulse of like 1 second. Let's just say I'm going to only work on, this would be a left foot. Okay, so let's say I'm doing the lymphatic drainage point on the left. I'm going to go down from the webbing until I fall into a little depression. It's just below the joint from the phalanges to the first metatarsal, between the first and the second. So just below that metatarsal phalangeal joint. And there's a little depression right in here. And if I'm doing a pumping, I can just do like a 1 second pump, like 1, 2, 3. But I could also do a slower one, like maybe 3 seconds, like 1, 2, 3, and release. 1, 2, 3, and release. 1, 2, 3. So the slower you go, the more swelling, the slower you can go. Or you can just do a sustained hold. So just hold it. In reality, as long as you're working the reflex, which is talking to the body and saying, hey, lymph drainage point, is there anything you can do up there to help this work better? In reality, you can work it however you want to, just like all reflexes. Right? But that just might be something new for you to try. It might be very good for you to try and maintain your own focus and intention while you're working that, as you're dealing with the body's intention and checking into itself. So working on a specific lymph drainage point and trying a pulsing move or a hold for a longer period of time, instead of just going like hook, 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 and move on to the next thing. Okay, the next one is transverse spread technique. And what I love so much about this one, anyone who's here who might have been my student before, I call these, they're almost energy techniques, but they do have a physical response. They have a physical effect. But I call them like non-techniques because you're almost doing nothing at all. And most of it is based on intention. So however you need to intend something to happen, whether you need to visualize and imagine it or do some talk inside your head to the body. But what's going to happen here is if our lymph reflexes are between all the long bones in the foot like this, and if we imagine that the energy points are really just, or the reflexes are just energy, right? They're energy points. If this is squished or squeezed, if there's not enough room in here, then congested energy could also be in here. So don't we want to like open this up a little bit and leave more room for energy to flow in between those bones of the foot? So the intention here is widening the foot via the metatarsals, just like this, like a metatarsal spread. We probably already do something like that within our session when we're doing what would be called maybe chest openers or long openers, right? When you're drawing the foot apart, or if you're doing it this way, right? So when we do that, that's a manual version. You're kind of mechanically actually spreading and opening the metatarsals. And that also applies, and that would be good to do deliberately, specifically for lymph, not just for the lung. But if you do it energetically with intention, I don't know why this is, if it really just is energetic intention that's communicating, or if I'm in position like this, and I think, spread metatarsals, like wide and open up. If my thinking is enough of a cue for my brain to make a little micro movement happen here, which triggers a little response in the body, that it gets it as a communication, I'm okay with that too. So I don't care how you think about intention, whether it really is, you know, a little micro movement because I'm thinking it and my body micro moves, you know, as I'm thinking it, or if I really am just thinking it and somehow my intention is affecting the reflex. Either way, stay in your position. Don't do anything. Do nothing but think of the metatarsals spreading and stay there for 5 to 10 seconds. You may literally feel like the foot kind of goes and pushes your hands out. Now, if you guys have your, if you guys have your feet in your own hand, your foot in your own hand, just take one foot and cup it in your own hand. Now, we're not squeezing. We're not making a container where we want to hold it. We want to give it freedom to open. We want to give it just freedom. So all you're doing is providing this nice, light little envelope of intention, okay? A little envelope of intention over those metatarsals, over your broad foot. And you could even kind of close your eyes in your own body. See if when you intend for it to spread, does it actually feel like it's kind of pushing your hands out a little bit? Just, it's really small. It's beautiful. That, honest to God, is an incredibly effective technique for lymph drainage. Now that you've opened the space energetically, now when you go in and work on those lymph drainage channels, those areas or the valleys between the bones, that's going to be that much more effective. So I'm just going to challenge you to try that, no matter what you think of that. It's absolutely amazing. It's such a non-technique. It's such a non-pressure. You're really just providing this little energy intention envelope for the foot, and you're intending it to spread and open. But then beautiful work down through those metatarsals, between the metatarsals on the lymph channels. And we really are increasing energy flow via those reflexes. So that's a lovely thing to try. Okay, so either a deliberate spread that you're really doing, or you can do that energy version. The third one is foot dorsiflexion when you're working on the groin lymph. Now, some people I think naturally just have started doing this anyway, so it might be a technique that you already do, and maybe you didn't realize how helpful it is. But one of the techniques for pressing along groin lymph, how we do it in my training, is you anchor your thumbs on the heel and you point your fingers with no fingernails directly into this ankle joint. So the valley of the ankle joint itself, where the foot connects to the legs, it will be underneath or inferior to both malleoli, right, underneath both the ankle bones. And it's in that little valley. So with your thumbs anchored, you're just pressing and pressing and pressing along the groin lymph. And you can really get in there and work that area. Remember, that's the inguinal lymph nodes. And so anything lower body, you really need to make sure that these are clear so that they can move energy up the body. What you can do here is introduce some dorsiflexion. So while you're pressing, actually move the foot back and move it back. Do your rocking and do it rhythmically and do it slowly. And so this is your rocking as you're doing. Now, don't forget to move. So top and sides, top and sides, top and sides, right? And keep working on that, but do a little bit of dorsiflexion as you're doing that. So introduce that along with it. What that relates to and what makes it very cool in terms of an equivalent technique on the larger body, if you do have access to touching and moving the larger body, like if you're a massage therapist, you've got some other kind of touch therapy and you feel comfortable doing it, what it relates to is actually a passive hip flexion. So if your client's lying on the massage table and you lift their leg, not them, you, because you don't want them to engage their muscles at all. Their muscles have to be completely and totally soft. But lifting the leg and then bending the knee and the hip so that the knee's going up towards the shoulder like this, passive hip flexion like this, is actually a mechanical lymph pump for the groin, right? It's part of lymphatic drainage massage and lymphatic drainage techniques. So this is what we're doing. We're mimicking that. We're mimicking it at the groin with this flexion of the foot and giving that body a cue. Hey, what would it be like if you could clear those if we're actually mimicking this whole passive flexion thing? And if you can actually touch bodies, if you're certified in more things than just touching the foot, then you can certainly actually lift the leg and do a passive hip flexion. And again, that is slow, deliberate, like count to, you probably do like a 3 to 7 second interval of working with that. Okay. Oh, awesome. Someone just said that reflexology lymph drainage is their main treatment they do with the clients. That's lovely. Okay, so then you could also loosen the joints. This one I do all the time. I specifically focused here. We just did something for groin lymph and I focused on the inguinal nodes. But I also want you guys to be able to focus deliberately on the axillary nodes. So if we know that the axillary nodes are here, right down in the kind of like, you know, towards zone 5, between 4 and 5 or 5 of the actual torso. So this one would relate most to the inguinal nodes, although it's being supplied from lymph vessels that are coming from all across here. So don't worry so much about exactly being in here, but these are the nodes themselves for that area. And if you are working in here, let's say someone did have some lymph nodes removed, or there's some congestion in here, then what you can do, or an infection, right? It's like maybe they actually did cut the side of the rib or something. So grab the 5th metatarsal, grab the bone, the 5th metatarsal, and then grab all of the other 4 metatarsals in your other hand like this. And I want your fingers to line up like this. This one on the 5th metatarsal, this one on all of the other 4, with your thumbs holding them. And what you're doing is you're loosening it like this. You're going to actually move the joints back and forth. So you will loosen them like this. This is another one of the principle. You're kind of holding this one, and moving them. It's another principle of actually loosening and opening an energy area for a reflex so that energy can flow more freely through there. Okay, so if there's any congested energy in through here, that nice wiggle when loosening the joint is an amazing technique to, again, open that up and free some of that congestion. Okay, and then finally, if we go back to the map, I'm going to show you the map again. And loosening side to side or up and down. Like I just saw somebody ask loosening side to side or up and down. I'm doing this. Here's the 5th metatarsal. Here's all the other 4. Okay, so here's the client's foot. I'm exaggerating it. I'm going like this. Does that answer? Okay. All right, and then finally, I'm just going to show you the map again so that we can see the reflexology map. I want you guys to check out cisterna see if you can find it on your own body. So it's definitely in the lumbar area. And it's along the spinal reflex. So what we're going to do here is pressure glide the cisterna to affect lymph uptake from the lower body. So you can just do this, pressure glide along the cisterna Okay, so you're just kind of pushing it up. And it's going to remember that it will, from there, from cisterna it's going to then go up the main thoracic trunk that is just ahead or anterior to the vertebral bodies. So it will eventually go up the spine. So we're trying to push it in this direction. Okay, and eventually get drained into lymph drainage up here. So as long as you know where that reflex is, focus on the lumbar area. And then your pressure, if you watch this little pointer, your pressure is going to be like this. You're pressing along it and up, just a pressure glide, along it and up, along it and up. Because it's just kind of like you're pumping that little receptacle, that little bladder that's holding some excess fluid. You're just triggering it, saying, hey, cisterna is it time for you to release some of that and push it up the body? And then if it wants to, it will. So there's that one. So in addition to that, we have a few bonus techniques. I think I have just a couple minutes, but I'll speed, but you've got it in your books. And it's nothing that you couldn't do on your own anyways. Bonus techniques are gentle effleurage up the leg. So if we're actually working on local lymph via the reflexes, whenever you're doing reflexes at the feet, you're also working locally at the foot. Whenever you're doing reflexes at the hand, you're also working locally at the hand. Oh, and by the way, all these are on the hand as well, right? So all the reflexes translate and all the techniques translate. So like loosening the joint, for instance, if you were holding this one steady, then you'd be loosening this one as well. Okay, so all of them work. But anyway, so at the foot, if there is actually swelling or swollen ankle, and you've actually worked on moving some of that lymph along and doing all the lymph channels, you can just do the lightest little effleurage. You are not stretching the skin or the fascia. You are not actually stretching anything in terms of the lymph channel, of the lymph vessels themselves that are in this area. But what you're doing is giving the body a hint, yet again, an intention, like, hey, body, how would it feel to get that lymph moving in this direction? Okay, it's just a communication. You're just communicating with the body, and you can do that just the whole lower leg, and an effleurage or a very, very light, gentle touch, like I'm talking like this. Okay, like really, really just a light glide as a form of communication to ask the body how would it be if it was moving the uptake of lymph in this direction. Okay, you're just communicating via the reflexes. You could also apply firm pressure into the webbings between toes and fingers. I do this frequently. So every time I feel like I'm getting a cold or whatever, I'm doing this. I'm working between my fingers. I'm working between the toes. And you can do just a sustained or direct pressure, but a lot of work on the webbing. We do see on the reflex charts that it starts here and goes down, but I think a lot of us, when we're working, we kind of forget about the starting point and we just kind of start somewhere here, or we forget that it actually begins here and we just start going down, right? So make sure that you actually are working from the webbing down and get that top part of the lymphatic channel. Thumb twists over the ankle are like this. And this would be a local thing that would encourage local movement. So here are your thumbs, and you're just going to twist them up as if your thumbs they're just going in like semicircles and twisting up. And you can do the front, and you can also do it at the back, a little twist, a little twist. Neck, working the neck, toe 1 in zone 5 specifically. That area we've learned as a throat reflex. But if you think about this area right here as this area right here, if you kind of peel away that really large muscle, the sternocleidomastoid muscle at the side of the neck, if you peel that up, there's a whole bunch of lymph nodes all through here. So you could actually drain that down the toe, which would be encouraging it down towards lymph drainage. Because remember, the head and neck drain down. Passive knee and hip flexion. I have put in your notes that is not reflexology. So if you aren't someone who can touch bodies, then you probably want to leave that one out because it's not reflexology. So it wouldn't be covered under your reflexology insurance. But passive knee and hip flexion, putting the knee up to your shoulder, or if you're working on your mom, or if you're working on yourself, get someone else to bend your own leg, knee to shoulder, so that you're completely relaxed and passive. That's a good thing to incorporate. And also work the reflex related to any swollen or injured body area. Remember to work the support reflexes, like the kidneys, to flush the excess fluid if you did take some swelling out. Full urinary system, we just try to go through the whole thing so that you can help flush any excess fluid. Also work the heart and the liver. If symptoms consistent with toxin release or health crisis appear, practice the 48 hours between your sessions, using shorter sessions and lighter pressure as you always would. And then how many sessions? Acute will be several close together. Chronic will be longer term over a longer period of time, as long as it's working. And that is the end. 1 minute over. Thank you, everybody.
Thank you so much, Jennifer. This was great. I know we had a bunch of questions that we weren't able to get to, but thank you again for your presentation. And thank you to our sponsors, Go Rendezvous. Please go check them out during lunch or before the end of the day. And yeah, so just thanks to everyone who joined in today. It was great. Awesome presentation. Thank you so much.
Thanks so much. Bye.
Bye-bye.